can you allow 24 million Americans to go through life without affordable health care?
This current system is not sustainable. We've said that again and again. It is not sustainable when you only have one insurer in 14 of 15 counties. It can't be sustained.
Wow, you heard that, right? That was Arizona Senator Jeff Flake facing very tough questions on health care at a town hall, as many Americans are still waiting for a new health care system. Joining me now, Paul Howard, Manhattan Institute Senior Fellow and Health Policy Director. Paul, great to see you. Look, you can't blame Americans for being upset that Republicans have not made good on their promise to do something. They promised for 7 years, it hasn't happened. But now Freedom Caucus members saying, hey, we've got a plan coming in the works. Do you believe that?
Look, I hope it's true, but I think this could also be messaging on their part. They caught an awful lot of flack for the collapse of the AHCA, the American Health Care Act. You know, the thing that I think could get them back to the table and perhaps help moderates get to the table as well is the idea that there could be some state innovation waivers that would allow states to decide what parts of the ACA's biggest insurance regulations they keep.
But what would that cover? So what would be state-by-state decisions?
So it might be things like essential health benefits.
Okay.
It would be requirements to charge everyone the same price called community rating. Can we have more variation there to get healthier people back in the market, charge them less?
But what about pre-existing conditions? Because a lot of our viewers like the idea that you would have to be able to get insurance if you wanted it if you had pre-existing conditions.
Look, that is one of the most popular provisions of the ACA. I think that's going to stay. The president has said he wants to keep that. I think what you have to do is find a way to make that work. It's not working under the ACA. Republicans have got to find a way to keep that and also get young, healthy people back in the market.
You know, I reported this week that the exchange that is most likely to go under first is in Knoxville, Tennessee, where as of 2018, it's most likely there will be zero insurers. It seems to me that Washington is fiddling while the rest of the country burns.
Look, and I don't know how the politics of this cuts, but you're absolutely right. There could be one or more, several exchanges that collapse, including several in red states. I think at that point, the White House is going to get involved. If I'm the House Freedom Caucus, I'd be thinking very hard about the kind of deals that President Trump might have to cut with Democrats to save those exchanges, and if that's better than the status quo.
The president, of course, this week was saying, hey, I'm just going to yank all funding. I don't even know if he could get away with that. But we talked about Republican conservatives. We talked about the Freedom Caucus. Let's talk about moderates now. What do they need to come to the table?
Well, I think, look, for those millions of people who've come to depend on the ACA, whether it's Medicaid coverage, whether it's exchange coverage, there's got to be a stable transition. The insurers have got to know this is going to be a stable market and this is going to work. That reassures the market. That reassures moderate Republicans. This is going to be stable.
Well, okay, so this all sounds so great, and maybe something could happen, but look, Paul Ryan's not even in the country at the beginning of the week, and I believe that Vice President Pence is out as well. So when does this get underway? You know, we're hitting our heads on the debt ceiling coming up very, very soon. When is this going to get done?
Look, it's a good question. I think we're talking about May at the earliest at this point. Obviously, they're going to be on recess till I think the 23rd. Look, there are some things they just have to fix. If you look at the exchanges, you find a way to put back money into them for tax credits, whatever. You have something called reinsurance that gives some confidence to the insurers. Well, look at it this way. If somebody's sick, really sick, we're going to balance off the cost of those people. Get the insurers to cover those people. We're good. We can be in that market.
Hope springs eternal here on the set of After the Bell. Paul, it's so good to see you. Thank you for coming in.